No, not yet. But send it in the group chat. I'll send it. Yeah.
All right, guys, I think we'll get started. So thank you so much for coming out here. Close to the mic. So thank you guys for coming out here. So tonight's our Pathway to Peds night presented by MUPPITS. So I just wanted to quickly let you know, each of your year levels has a representative. So if you have any Peds related questions, have a look at your specific rep and send them a message if you ever have any questions. My name's Aisha. I'm the Vice Chair of MUPPITS, and welcome tonight. We also have a bunch of resources online that can all be found at our website. So if you're ever struggling in terms of OSCEs and questions, which we do at the end of the year, just have a look online and we've got a bunch of resources. So tonight we have 4 fantastic speakers here that are going to take us through what PEDS is like, the program to PEDS, and what's involved. So we have Dr. Isaac Clifford here, who's a paediatric resident, Caroline Kassan, who's a paediatric registrar, Maurizio Pasili, who's a paediatric surgeon, and we've got Peter Gowdy here as well, who's a paediatric rheumatologist. So we'll get started with Isaac. So Isaac is a Monash graduate, and he actually founded and was chair of MUPPITS 2 years ago. He's now a paediatric resident at the Monash Children's Hospital. So please welcome him tonight.
How are you all? Thanks for coming out. And hello to everyone who's listening in as well. Unfortunately, I don't have any slides for you. I thought I would just give you a few little tips and tricks. There's not really much that you're going to need to write down. The only thing is at the end, which I'll mention, is the only thing that you need to write down. So I'm hoping that you're all from different year levels. But so to sort of start, so I was at Monash. I was here in Clayton, like you guys, for year 1 and 2. I was then an ERC student, so I went out to Bendigo for the most of my clinical years. I'm sure anyone ERC here? Yeah, good. Preclinical, I assume. Good, you'll love it. It's great. So I got to go to Bendigo. It was fantastic. So 3rd year, you do your general medical year, and it was good practice at Bendigo. They give you a lot of hands-on opportunities, which is really fantastic. Then for my 4th year, so you obviously do your pediatric rotation in your 4th year, for those who may not know. So Bendigo does it a little bit differently to the city. So in the city, you get your, quarter of the year is pediatric training. Bendigo, we only had 6 weeks of half the year, and then half the year is actually spent in a rural GP practice. So you still get to see a fair few kids out there. And, it was definitely, I don't think, a disadvantage at all. So whereas all the city kids will rotate through Monash Children's at some point. I really enjoyed rural GP and regional hospital work as well. Regional pediatrics is fantastic. It's really general pediatrics. So if you ever get a chance to do even maybe an elective or something like that out in a regional centre like Ballarat, Bendigo, Geelong, still pretty good in that sense. You get to see a lot of interesting stuff, and it's all sort of very general pediatrics. So really good grounding, especially while you're in med school. I then did my final year. So in my final year, you do a couple of city rotations. So I was at Casey and Monash for neurosurge. And then I decided to do a couple of pediatric electives. So at the start of my final year, I actually did a month in the Royal Children's ED. That was just an extra thing I did during the holidays. And then for those of you who are in fourth year, you're probably aware that you get an elective rotation in your final year. So you get to choose where you want to go, which is really good. They used to be able to do it and go on a holiday at the same time, but I think they've put an end to that. But if you can, it'd be great. So overseas electives are fantastic. But if that's not an option, unfortunately, sometimes you do have to stay locally, and you can look around Australia or in Victoria if you can't go interstate as well. And you can certainly do something like pediatrics. So I was fortunate enough to go to Dublin, and I did 6 weeks at the Children's Hospital there, and I did cardiology, cardiothoracics, and emergency over there, which was really interesting, fantastic. I got a little bit of a taste of each of those. And then you also get to choose one of your rotations as well as selective, and I chose to do Bendigo Paediatrics, so I chose to go back there and do some more peds up at Bendigo, which was fantastic too. So that's sort of how I went about my medical school, because I assume that a lot of you here are probably interested in pediatrics, and if you know that already and you haven't gone, you're not in fifth year already, then you can sort of plan out your year like that and try and do a couple of extra things. During the summer, if you want to do electives, it's a fantastic opportunity, and it looks obviously good on your CV, showing some interest there. But obviously, so we're talking about, I suppose, pathways to peds and how to get in and those kind of things. So what else can you do, I suppose, on top of that? So there's a lot of talk about research. I'm sure that you've all heard about doing research at this point. BMed-Scis are fantastic. I did not do a BMed-Sci, but if you're really research inclined, that's certainly an option that you could do. I actually found a pediatric emergency doctor and did a couple of research papers with him. They were just review articles, so I didn't have to do any data collection. We just worked together on writing up the article, which was quite good. It doesn't involve a really long-term commitment, unfortunately, which is what most studies do. But certainly if you enjoy research, I think it's really a fantastic idea. Even if you're in second, third year, you can start looking at it and thinking about it now, and pick something you're interested in and have a look and see who the specialists are in that field and ask them what research opportunities they have. Most people are pretty happy to answer your queries if you just send them an email and sort of politely outline your interests, and sometimes you can come up with some pretty good opportunities. Then I did a couple of other little research things. I did some stuff up in Bendigo as well. So those who are in rural areas, if you're going ERC as well, don't feel like you can't do research when you're out there. You can. You just need to find someone who's interested out there, or you can always work with people in the city and obviously correspond by email and things like that. So don't feel too disadvantaged for that. Then I suppose other things is extracurricular activities. So obviously I worked on MUPPITS with these guys, and they've obviously done a really good job of continuing through. And I think that's helpful, and things like that are really useful. If you're interested in peers, it shows that you're interested and that you're actually making a commitment to doing some work. Teddy Bear Hospital, I'm sure, is still running. That's a great way to get involved and get a bit of sort of exposure to kids and outside the hospital environment too. So you're seeing kids in school, and it's actually a really great way to sort of introduce them to going to the doctor and going to the GP and all those sorts of things, and having their ears looked in, which is always a troublesome thing for young children. So that's fantastic. It's good for the kids and it's good for you too. So that was sort of my medical school time. And then I suppose I should talk about internship as what I did last year. I went to Bendigo. I wanted to go back because I knew the hospital really well and the people there. And the other big draw card for me was the fact that it's a mixed emergency department. So I was actually able to see a lot of kids in the emergency department up there. I did 2 ED rotations, one in Echuca and one in Bendigo. And both of them have a very high proportion of pediatric presentations. So something like 25 to 40% of their presentations are actually pediatric. And most of the trainees are adults and they don't really want to see kids, so they'll let you do it, which is great too. So that was fantastic. It was a really good experience for me, but it's also something that you can talk about, because those of you who are probably a little bit later on and starting to look at, getting into pediatric training and things, you're probably aware that it's quite competitive to get in to your first year of training. And unfortunately, a lot of people are coming from internship and you don't have any pediatric experience at that point. So it's hard to compete with people who have pediatric experience. So it's one thing that you can do to help in that sense. I was also lucky enough that the surgical team that I worked with in Bendigo also had the pediatric surgeon attached to them. So I got to do a little bit of pediatric surgery there. Maurizio probably knows Prof. Pennington up in Bendigo. So that was fantastic too. Not a lot of kids up there, but you still get to see some good stuff. And so that brings me to this year. So this year I'm a JRMO, which means I'm doing my first year of pediatric training. So once you're in, so you have to be a JRMO to be in the program in Victoria. It's the only way you can become a pediatric trainee. And from there, after that, your time will be accredited as long as you find an accredited job, either in Victoria or an interstate. So once you're registered with the college, then you're in the program. So I'm not sure if many of you know much about getting into the program, but the jobs start, so you apply sort of mid-year around now and you'll find out, so middle of your internship. So for those of you who are in fifth year going on to internship and you're thinking about this for next year, you will need to get onto your references early because obviously you've only got 2 rotations to get references from. And so you apply, you go through the interview process and they select about 46 pediatric trainees. There's 56 total spots, 52? Yes, 52 total spots, but some of those are for surgical and GP trainees and they're not accredited with the college, so you won't be part of the pediatric training program. So obviously it is very competitive, but it doesn't mean it's impossible. Most of their applicants, or half to a bit more than half, are from internship. So, if that's really where you want to go, then there's nothing stopping you, and you certainly can be competitive in that sense. So I suppose I could tell you a little bit about my year. So I did ED as my first rotation, and then Hem-Onc Gastro now at Monash Children's, which is fantastic. We have the new hospital, so everyone's finding their way around, which is great. And then Gen Med back at RCH and some nights and relieving, which is a pretty typical year. Most people will do a rural term as well, and there's also a lot of surgical jobs, so most people end up getting a surgical job sometime in the year as well. So that's sort of what your typical first year of training would be like. It's obviously really good. You get a bit of exposure, especially obviously if you're going rural, you get very good Gen Peds exposure. You'll get to do some neonatal stuff at most of the rural sites as well, because neonates is mixed, whereas in the city, so RCH and Monash, they have separate neonatal units, which you're not actually a part of. So that's fantastic. So obviously rural experience is good. And then, you do a couple of rotations in the city and get some specialty time, hopefully, and see some very specialized pediatrics. So I suppose my typical kind of day, so it's essentially what you see all your interns doing. So I'm basically a pediatric intern now. So I'm attached to a specialty team. So I'm doing gastroenterology at the moment. So you do your ward round, you see your specialty patients, and then it's a lot of organizing their treatment, making sure that they're okay, and also organizing outpatient things. And especially for gastroenterology, there's a lot of outpatient work. So patients just coming in for day procedures, infusions and things like that. Those of you who've done some pediatrics would know about gastroenterology and inflammatory bowel disease and those kind of patients. They're all very long-term patients. So the bosses know the patients very well. You can pretty much call them about anything and they already know the patient. Even if it's not usually their patient, they'll actually know all about them. So it's really good, very supportive, obviously a fantastic environment to work in. Those of you who have been through peds will know that everyone's really nice in general and very supportive. And if you're interested, they'll take you under their wing and help, which is fantastic. So I suppose what I was going to say is, from my point of view, what can you do at this point to try and make yourself a bit more competitive if you want to get into pediatrics, or even if you just want a bit more experience, just to see what it's like and see if you like it. So certainly what I'd recommend would be looking at electives. So if you can do some extra things, if you're not in final year, then you can do it during your holidays. Preclinical years have a lot of holidays. You can still get some good experience. Make use of it, it's great. And then obviously if you are older, so more senior, you can look at doing it in your final year and maybe even going overseas to somewhere interesting. The other stuff, obviously extracurricular things, you can always apply to MUPPITS, and that would be fantastic. But there's other things as well that you can do extracurricularly, so volunteering. There's other pediatric related committees that you could join, but certainly, even things like volunteering at Ronald McDonald, at Monash Children's itself, or RCHO volunteering programs. They're all great ways that you can sort of get a bit involved and see some kids as well. Research is obviously a really good option. Probably those of you who are a bit more senior are maybe a little bit more used to that, and that's probably a great idea. But the last thing I wanted to say to you would be that on the 16th, next week, 16th of May, RCH is holding an information session. So for the more senior medical students, if you're interested, that would definitely be a great thing to go to. So they have a medical student session earlier on, I think from 5:30, but just double check the website. And definitely, if you're really interested, I would turn up to that and get a bit of information. And then you can think about it and start planning for next year. So, any questions or anything at the moment? Pretty happy? Awesome. All right. Well, thank you very much for listening. Have a good day.
So thanks so much, Isaac. So next we have Caroline that's going to speak to us. So Caroline's also a Monash graduate, and now she's a paediatric registrar at the Royal Children's Hospital. She's going to give us a bit more of a rundown of the actual paediatric training program and tell us about her experience into it. So let's please welcome her.
Yeah.
All right, so there we go. So a little bit about, oh, now it's gone back. Sorry. Cool. So a little bit about me. So as the others were saying, I graduated from Monash back in 2011. Similar to Isaac, I was interested in peds and did some rotations at Monash and at Dandenong as a fourth year. And then as a fifth year, I did a selective at Monash Children's doing pediatric endocrinology. And then in my elective, I organised to go overseas to New York and do pediatric oncology, which was really good. And then I did my first 2 years of work at the Alfred. Back when I was an intern, they used to have a PG-PPP program, which unfortunately I think they got rid of. So I did a GP rotation, which was a good opportunity to see some kids. But other than that, I didn't see any children for 2 years. I applied internship but didn't get in. I got in on my second attempt. So I did another year at the Children's, not at the Children's, at Alfred. And I'll talk a little bit later about what I did in between to sort of boost my resume, I guess. And then I've been working at the Royal Children's now in the combined Royal Children's, Monash Children's training program. And just so you're aware, if you are lucky enough to get into paediatric training within Victoria, do expect to work and live in lots of different places. So that's just a few of the hospitals that I've worked at so far, but everyone does some rural time and you do get quite spread out across the state. And then at the moment I'm working at Monash Children's in the emergency department. And from September this year, I'm actually going to be working in London. So definitely one of the great things about paediatrics is there's lots of overseas opportunities and lots of senior staff and hospital relationships. So I think I'm one of about 8 trainees who are going to be in London from September this year. But I've got friends working in Laos, Solomon Islands, Canada, all over. So there's lots of opportunities to travel as well. So I got asked to talk a little bit about getting in. And so as Isaac was saying, in Victoria, it's a combined Monash Children's RCH training program. But one thing that I wanted to put out, which has been successful for some of my colleagues, is there's also opportunities to apply interstate. So I've worked with lots of people who've either moved back to where they might have come from before moving to Victoria for uni, or even Victorians who were unsuccessful getting into Victoria but have had success getting in, particularly into New South Wales, because there's two major teaching hospitals, Sydney Children's and Westmead. I know South Australia only has a very small pool of about 12 paediatric trainees accepted per year, and Tasmania even smaller again, but always opportunity if you're really keen to apply abroad. So I've just stolen off the Royal Children's website the information about the info session they've got next Tuesday. So that's got all the times and stuff there for you. And they're very much the experts. Things have changed since I first started. So as Isaac was saying, there's 52 JRMO positions. When I went through, it was about 2/3 interns becoming HMO2s and about 1/3 HMO3+. So definitely great opportunity applying intern, but not all hope is lost if you don't get in first time round, like myself. So definitely more senior applicants can have more experience. They can be popular in that sense, but they're also more expensive. So that's why there's a large number of HMO2s as well. And with the streams, so that's just the numbers from the website. There weren't streams when I went through, so I've stolen all of this. But importantly, you can only apply to one stream. You can't sort of try and apply for everything. They're onto you if you do that. So then in terms of applications, so on the website, this is more for more senior students. The RCH JMS website's got an application form for you guys to fill in, cover letter, CV and references. RCH really like nursing references, because often as junior staff you work much more closely with nurses than you actually necessarily do with your consultants, depending on the rotation. And in my experience, the nurses are always really chuffed to be asked, because it's not something they get asked very often. So I think when I applied in my second year, I didn't use a nurse the first time. And the second time I used a geriatric care coordinator nurse, and she loved it. So that's really good. And then if you're lucky enough to get shortlisted for the interview process, again, this is different to what I did, but there are 5 stations with 5 minutes duration each, and always worthwhile talking to colleagues who've done interviews recently, because the questions don't change often. So you can get some hot tips about what to prepare for. This was also up for sort of more of the more senior guys, but what I wanted to point out was that for paediatric training, you have to be present at the interview. They don't accept phone interviews. So it's useful the year that you're looking for applying to around sort of May is usually when application information starts coming up, looking ahead as to when the dates of interviews are going to be, because it's really unfortunate if it's going to ruin your holiday, and it's nice to know earlier rather than after you've already booked something. So if at first you don't succeed, which was my experience, there are lots of other options. So there are lots of HMO rotations available both in metro and rural sites, which in my experience working at the peripheral centres, lots of doctors who have done HMO sites have then been very successful applying again. Other things that I did a diploma of child health through Westmead, which was an online diploma, which gives you a great overview of paediatric health, and a lot of GP trainees also do that as well. You can show some interest by attending conferences. I went to a conference that I would highly recommend, which was Paediatrics in the Islands, which is run by the Children's Hospital of LA in Hawaii 3 times a year. And the conference just runs from 8 till 12, so you have all afternoon to enjoy Hawaii. But also what's good about it is paediatrics in the US is quite different to Australia in that most paediatricians in America are much more primary care paediatricians. So instead of going to see a GP up until the age of 18, you often go to see a paediatrician. So the conference is run by hospital paediatricians giving information to primary care paediatricians, and it's much more general, and it's quite an approachable level for students or people with limited paediatric experience. It's not really technical over your head stuff. So I really enjoyed that. And then as Isaac was saying, volunteering is really good. I volunteered with Down Syndrome Victoria. Lots of people I know volunteered with different paediatric specialty groups like Canteen, the Paediatric Cancer Specialty, and things like that. I personally didn't actually do any research, which is rare. But I think if you show lots of interest in other areas, maybe you can get around that, or maybe these days it's too competitive, I'm not sure. And then a little bit about the training program once you get in. So similar to adult physicians, training for paediatrics is run through the RACP College, and it's divided into basic training and advanced training. Basic training takes 3 years full-time equivalent. So some people do this full-time, some part-time, and there are some minimum requirements. So you have to do a minimum of 9 months of general paediatrics, minimum of 3 months in pediatric ED, minimum of 3 months in neonates, though often it ends up being more than that, and a minimum of 3 months of specialty pediatrics. Everyone has to complete a advanced pediatric life support certificate, which some people, again, if you're wanting to show interest early, do as students rather than as doctors, but it is an expensive course, so useful to do when you can tax deduct it, I would say. And then there are examinations, which always makes everyone groan. So there is a written and clinical examination that are held once per year, and to progress to the clinical, you have to have passed the written first time. So I don't want to focus too much on examinations because it always brings everybody down. But the hot tip that I would say is there's sort of a trend for people in paediatric training to do the exams early, but I think you have to be really ready to study and become a bit of a hermit. So there's no reason why you have to do it when most other people are doing it. You can definitely hold off, get some more experience and sit it later and really be ready to sit the exam rather than give it a half-assed try and fail, and then things build up with anxiety and all those sorts of things. And then once you complete your basic training, you then move on to advanced training, which there are lots and lots of options. I think there's something like 26 specialties that you can choose from, and there's lots of opportunities for dual training. So you can combine general pediatrics with something like rheumatology or whatever else that you're interested in. So I think that was most of what I had, and then I just had some fun pictures. So to point out, especially the kid up in the top corner is actually in a wheelchair, and that's his costume's been adapted around it. And below is myself and one of the other pediatric trainees when we were JRMOs on Ped Surge, dressed up for Halloween. So yeah, does anyone have any questions? Awesome.
So thank you so much for giving us more information on the training program. So next we have Maurizio. So he's a consultant pediatric surgeon at the Monash Children's Hospital. He did his medical training in Italy, and then did his surgical training in the UK, and then some more surgical training at the Royal Children's. I'm pretty sure he has an interest in some minimally invasive surgery in neonates and peds. So please welcome him tonight.
Okay, thank you very much, everybody. And it's a great pleasure actually to be here because I wasn't expecting them, there's a lot of people here. Anyway, so I'm coming from obviously a different background, but I'm not trying to, go through all the different, steps for pediatric surgery. But is actually any of you interested in doing pediatric surgery? No, one. Oh, yes, one. Fantastic, good. Well, maybe I can convince more of you. Obviously, you can tell from my accent, I'm not from Australia, but that's very clear. That's my email there. If any of you changes his mind and wants to go into pediatric surgery, just drop me an email. We'll have a chat about it. But I'm just going to share with you what it's been for me being a pediatric surgeon. What where I'm coming from. So fantastic, isn't it? Monash Children's, beautiful. The rooms are amazing. The parents are very happy. Actually, their rooms are bigger than my room when I was a medical student in Italy, really. So I just want to be there. I mean, I don't want to go home. It's just like, I want to stay there 24 hours a day. It's brilliant. So no, it's great privilege because it's all brand new. It's fantastic. This is my first year as a consultant, so actually starting at the Monash Children is absolutely fantastic. This is what I did before I became a doctor. I was a medical student at the University of Rome, and it's kind of a little bit different from what you get here. But it's if you go around Rome, just go by, and it's called Sapienza, which in English means the knowledge. So you can tell where I'm coming from. Then I did my first residency in general surgery. I must say it wasn't the best experience. That was one of the first books that they advised me to buy. I spent a lot of time doing manual, disimpaction evacuation in old people. It was a little bit, I thought maybe this is not for me, actually. I'm not really sure I'm going to enjoy this too much. But anyway, it was a good experience, a lot of, start making some friends, start being a doctor. Then I went to do transplant, which was absolutely fantastic, as you can imagine, very posh specialty. Beautiful wards, you think about the on-calls, you get the ambulance, you go running around the city, getting organs. And I was so excited, the first time I jump on the ambulance, we ride across Rome, we go 2 hours away in another hospital, and I was very excited because for the first time I actually can get into theater. So I did get into theater, and I had actually my own little operating theater. And what I did was this, literally crushing ice for the organs to be, put in. So again, I thought, is it transplant for me, really? It's kind of, well, I'll think about it. So I almost actually, to be honest with you, almost decided to change and do something else. I was actually going to be a pediatrician. So I went into the pediatric department, and when I'm walking through, I see the pediatric surgery department. I was like, oh, very interesting. And the first thing that I've seen is the head of the department had this big, little cartoon on his door. And I was like, this is a little bit different from the adult surgery. So I went in and I just introduced myself, and it was very friendly. So that's how I started being a pediatric surgeon, because I almost literally gave up and became a pediatrician. So then I moved to London, actually in 2003. I did my research. I did a high degree. I spent a lot of time doing research, lots of conferences. I mean, I know maybe not all of you are actually interested in research, but I had a fantastic time. When I did my high degree, lots of conferences, been to America, been to Canada, lots of places. And, it's very good. You go around, you meet a lot of people. You actually, you can measure yourself, and see what you're capable of, talking in front of 300 people in a big conference. So I think, for me, it's been an amazing experience. So I moved in from University College London. I got into the training system in UK. And I spent a few years wandering around Cambridge, Oxford. I spent 1 year at the Royal Children's Hospital in Melbourne. And I'm not going to go into the details of the training because, there's a lot of information on the Royal College website, but we can have a chat about it if you're interested. And then I've became a consultant pediatric surgeon. This is my first job here in Australia as a consultant, so very happy to be here. What do we do in pediatric surgery? Well, we treat only children as, up to 16 years of age. Sometimes we go a little bit more than that, like 17 or something like that, but it's very rare. It takes 7 years to become, from when you start your training to become actually a pediatric surgeon. So it's a little bit of a long pathway. So if you want to, think about it, but it is, you move around lots of different places in Australia. You go, they can send you pretty much everywhere because the training is centralized. So you can go to New Zealand, you can go to Tasmania, you can go to Sydney. It's very widespread. We do lots of little things in pediatric surgery. We do hernias, understand the tests. As you've seen, some of you have been in clinic, you've seen a lot of these things. But, the fun is in the congenital anomalies, the big stuff. Lots of fun and very delicate surgery, very intricate, very complicated. There's a lot of fun there. It's interesting because you had to kind of measure yourself with 200, grams, not 200 grams, but no, 600 grams babies sometimes. That's actually, quite difficult, but it's very challenging from the point of view. If you for some reason decide to change pathway and you want to become a surgeon, there's other people that do pediatric surgery. There's ENT, there's orthopedic surgeon. So you can become a different surgeon and specialize in that area if you want, which is, it's still also very, very interesting. Like I said, the neonatal surgery is probably the best of all the pediatric surgery. Lots of congenital anomalies. There's a lot of multidisciplinary support, and it's really the best part of that's why you become a pediatric surgeon, because it's the neonatal surgery really which is the best part. If you then decided later on or you want to subspecialize, so at the end of your training, you can go for a fellowship and you can decide if you want to specialize in neurology. And these are mostly the specialties that actually we have at the moment. So pediatric urology, which is there twice, I'm not sure why. Neonatal surgery, you can become just focus on the neonatal surgery, hepatobiliary, gastrointestinal, and oncology surgery. Now, pediatric surgery is probably one of the most, the specialty actually where you do a little bit of everything, even though there's a little bit of specialization, but compared to the adult surgeon, you have upper GI surgeon, lower GI surgeons. In pediatric surgery, it's not that clear, cut. So you can still, do different things. You can always change. If you don't like one area, it's always time to change during your training. Is it glamorous? Well, I haven't been on TV. I don't think you've seen me on TV, but probably plastic surgery is more, glamorous than pediatric surgery. GP is more glamorous than pediatric surgery. Even vets are more glamorous than pediatric surgery. So, if you do it for the fame, probably it's not the right specialty for you. But you do sometimes get a little bit of, fame, and that's me on the Royal Children's Hospital in Melbourne website. I made it on internet, so that's good. And that's Australia. I can't remember actually what it was, but it was fantastic. So you do get a little bit of, popularity. But if you if you really were looking for glamorous, you can always go on Instagram. And if you're really bored at 3 o'clock in the morning in the on-call room, you don't know what to do, you just take a picture of yourself, you send it on Instagram, LinkedIn, whatever, and and that's your moment of glory there. Now, I'll tell you what I enjoy the most actually in pediatric surgery. And I'll start with these little ones, children and families, of course, the little ones. There's nothing better than seeing a child which is terrified, coming to hospital, having an operation, and they don't know what to expect. There's a lot of people around. They put them in a little dressing gown, and they wheel into theater, the lights, the people there, what's going on. And then when they go home, they're happy, they're smiling again, that fear hopefully is gone, and it's just a little bit of memories. The families, they're great. They come to hospital terrified because maybe that's their first child or it's the only child they have had, and it just I met this family a few weeks ago that had the first baby, very young couple, and the baby was born with esophageal atresia, so quite significant problem. They had pregnancy, no problems at all, and then just at birth they found this condition, and they were terrified. So it was fantastic. They've been great. That's the best part of the job. The cons, what are the things that I don't like? Well, the children and the families. Yeah, of course, because actually, some of the families can be, oh my God, it's just difficult. One of the differences between pediatric surgery and adult surgery is that actually the adult surgeon, if you want, you just have to deal with that patient. You don't need to talk to the parents, they just relate to the patient, that's it. Pediatric surgery, you get the auntie, the second generation cousin, the neighbors, they all want to know what's going on, the grandparents especially. So, but yeah, you understand that where they're coming from. They're obviously very worried about the children. The kids, they scream in the outpatient, or they don't want to be examined, they just cry, they kick you. So, well, the balance, where does it go? But for me, I mean, it goes definitely, that way. I think, it's just fantastic anyway. The little problem is you just get over it. Now, in terms of actually technicality, I can tell you, if you're thinking about going to surgery, well, It is technically demanding. So if you like, playing with little things, that's probably the specialty you're looking for. But children are not small adults. It's a complete different areas. It's different, type of surgery. It's different instruments. It's different everything. It is a consultant-led specialty. So, you are in hospital all the time at 3 o'clock in the morning doing even simple operations, but it's a big responsibilities. The consultants come to hospital very often, more than the adult surgeons, I will tell you. Probably more than the pediatricians, I think. Yeah. But there's a little bit. Yes, there's number of jobs are not too many because there's not many pediatric surgical centers. But there's a big 1 or 2 big pediatric surgical centers in every big cities in Australia anyway. So it's also quite competitive. But if you're willing to move to live, if you like to live in a big city in a large pediatric center, then there's plenty of opportunities there. And there's a lot of opportunities for research. There's a lot of things going on in pediatric surgery. There's research nowadays in stem cells. Hopefully, I don't know if you've seen the news, but in 10 years, we might be able actually to transplant a esophagus which has been grown from the pigs. So there's a lot of opportunities for research. Is it for the ladies? Well, it's in 2017. It's a little bit strange talking about boys and girls and medicine. But I've been in surgery for a long time, and there are some specialties that are a little bit more boys, kind of, little clubs like orthopedics, the neurosurgeons, they're just a boys club. Pediatric surgery actually is not like that. It's very friendly if you wanna, if you're a lady, and it's, we have in our department we have 40% of our staff is actually it's girls, so that's good. So think about it. It's definitely a specialty for the ladies. Rewards, that's the best part. There's nothing better than being a pediatric surgeon and getting some rewards. Well, if you're looking for kind of, stuff like that, well, you're not going to get it, I can tell you. But there's other things that definitely are worth. Yeah, for sure. You do get a lot of bottles of wine, and especially if they find out you're Italian. Chocolate always, so that's always a good thing. You get that. You do get your rewards. But if you're a little bit lucky, like I've done a lot of research, you also get a little bit of proper, rewards, and you do get to get some prizes and things. But you need to work hard and do research. But I mean, like I said, I enjoy research so much that I think everyone should do a little bit of research at least, during the initial years. Now, probably this is the best part. And the little cards, the kids make them for you. They just, say thank you in so many different ways. It's absolutely fantastic. And I've been collecting them over the years because the best ones, the ones that I really like, is the ones that have been actually the kids that just throw the pen for you. And I think that was me. Different eyes, colors. I'm not sure why. Again, that I think it was me and Samuel on the patient. If sometimes I'm lucky, they also managed to spell my name correctly, so that's good. But you do get a lot of this in pediatrics, which is good. And if you're lucky, you even get a fish name after you. So that's fantastic. So that was me and one of the patients. It's actually from the Royal Children's Hospital, so good memories there. But obviously, there's nothing better than a child, smiling after a big operation, and you spend 4 hours fixing them. And of course, this is a little boy here at the Royal Children's Hospital. But anyway, it was good fun, and in the end, I managed to get him a little smile. So look, if you want to become a pediatric surgeon, just get in touch with me. I'm not, I didn't want to bother you with the information about the pathway, but there is a lot of information on the Royal College website. But we can have a chat whenever you want, and then just drop me an email. But I hope I managed to give you a little bit of flavor what is like being a pediatric surgeon. I hope some of you seriously will consider, because it's a fantastic specialty. And I think that's the last slide, actually. Yes. Any questions, anybody? Good, no questions? Good. Okay.
hopefully do a question session at the end. Yes. So thank you so much for giving us more of an insight into the surgical side of paediatrics. So lastly, we have Dr. Peter Gowdy, who's a consultant paediatric rheumatologist and general paediatrician who works at both the Royal Children's Hospital and Monash Children's. He's a Melbourne graduate and he did his training at the Royal Children's Hospital as well as some training, I think, overseas in Canada. So he's going to give us a bit more of an insight into what his day is usually like as a paediatrician. So please welcome him.
Thanks very much. And thanks for the invite tonight. It's great to see so many people interested in paediatrics. That's great. So you did a bit of research. That's great. I suppose it's not too hard these days with Google. But so I'm Melbourne born and bred and lived and grew up in the southeastern suburbs and went to Melbourne University. I won't go into too many details about my early training because it's sort of been covered anyway. But just to say that that I studied locally and did my intern year at the Royal Melbourne Hospital. And I guess I wanted to spend a bit more time about what I actually do during the day, but my training to get to where I am has been fairly standard in some ways, but maybe a bit different in others. So I applied during my intern year to a JRMO position, and I was lucky enough to get it. And this is the old Children's Hospital, which I have very fond memories of, which is now obviously Parkland. And it's obviously a co-joint program between the Royal Children's and Monash, which it has been for many, many, many years. So I did my JRMO year and then progressed through the training. I had some time off at different periods, years away, years overseas, working in the UK, locuming. I wasn't really in a big hurry to get through my training, which I would thoroughly recommend and happy to answer questions about later if needed. And then progressed through training. And at some point in my training, very early on, I knew I wanted to do paediatrics. In fact, when I was a university student, I wanted to do paediatrics or surgery, and I didn't think to combine the two. I maybe should have done that. But along the way, and as you saw with the training program, you get exposed to different specialties, and I realised very early I wanted to do general paediatrics. I loved general paediatrics, but one of the things that I came to realise is the thing that I loved about general paediatrics was the acute inpatient general paediatrics. And one thing that's probably worth mentioning up front is that general paediatrics in Melbourne, at least, most positions as a general paediatrician are community-based positions, and whilst there are positions in acute inpatient paediatrics, there's fewer of those positions. So I grew to love the acute inpatient stuff, and then developed an interest in paediatric rheumatology. Before I did that, though, and it's worth mentioning, I did some time in the country. So as part of the paediatric training program, you have to work rurally, and this is hospital in Warragul. Some of you may recognise it because I think university students rotate out there. And I would thoroughly recommend some time in the country, and this is, Isaac mentioned this, it's a terrific way to get a lot of general good paediatrics and paediatric surgery and all of the subspecialties. So I thoroughly enjoyed my year out there. But at some point along the line, I decided that I was interested in paediatric rheumatology. And this was because of a job I did at Monash as an SRMO, and then later as a general paediatric registrar at the Children's, which one of the units is attached to rheumatology. So it was just one of those things that I got exposed to and developed an interest in. And so in paediatric rheumatology, we see a broad range of conditions, most of which are very rare. So there's some you might recognise and some you might not. So it's a little child with juvenile arthritis with a fixed flexion deformity of the knee, a boy at the top here with juvenile dermatomyositis, a child here with Still's disease or systemic arthritis, and a child here with Kawasaki's disease. So the spectrum of paediatric rheumatological disease is very similar to adult rheumatological disease, but as Maurizio says, children are not small adults, and it definitely has its challenges and other issues that need to be considered. So with my interest in paediatric rheumatology, I had to find a pathway to train, and this was a challenge for me because there was no paediatric rheumatology training program in Australia, and in fact there were no jobs even as a trainee. So I decided I needed to eventually one day work full time. And in order to do that, I needed to do dual training. So I've completed my general paediatric training, and during that period, convinced the Royal Children's to employ me as the rheumatology fellow, which was a new position at the time. So that was quite challenging, and so did a year as the rheumatology fellow at RCH, which was fantastic and a great grounding for what was to come, which was to apply for a fellowship overseas. So there's a couple of hospitals around the world that have a particular strength of paediatric rheumatology, and one of them is the Hospital for Sick Children in Toronto. So this is Toronto, and the Hospital for Sick Kids is a terrific place for most specialties, paediatrics, from every specialty really. So I spent 2 years as a fellow over there, and as part of that, it was essentially a clinical fellowship, but there was quite an expectation that research was part of it. And so, like Maurizio, I would reiterate how much fun and what a great time I had doing the research. It just opened up so many doors in terms of collaborating with different other units and other specialties, attending conferences, presenting to large audiences. It was a terrific experience. So I spent 2 years over there, and it was, in some ways, I was sad to leave, and I was offered to stay on, but I had twins over there, and I've got 4 children. So my number 3 and number 4 were born over in Toronto, and I had to come home for some help. So we came home, and we came home in 2012, and since then I've been working at the Royal Children's Hospital and at Monash. So my current role is divided, and really I balance my roles as a general paediatrician and a rheumatologist across the week. So I do quite a bit of acute inpatient general paediatrics, and that's at Monash, and where I'm on one of them. I see lots of familiar faces, so I've seen a lot of you on the general paediatric wards. And I also have a commitment to general paediatric outpatients at Monash. So that occupies that position, I guess, is about 0.4. I'm employed 0.4 EFT, so effectively 2 full days. But of course it varies, because when I'm on call for general paediatrics, I'm there all week, and when I'm not on call, it drops down. But my appointment is 0.4 EFT. I have a public appointment at Monash in rheumatology, so I'm employed 0.2, and that encompasses ward service, as well as outpatient clinics and joint injection lists, these sorts of things. So that takes me up to 0.6 of my time. I then spend some time in private practice. Before I mention that, I should say, so my commitment at RCH is at outpatient clinics. So I've cut back dramatically my inpatient service at the Children's, mostly because I'm trying to consolidate things to one site. And so I do 1 clinic a week at the Children's in rheumatology. Then I spend some time in private practice, and I do 2 private clinics a week, and that provides another challenge, and it's an interesting sort of balance in how to spend time in private practice while there's this rotating commitments in public hospitals. And I do some outreach clinics. So I go out to the country and do some outreach clinics in rheumatology. So it's a real mix of public, private, general paediatrics, rheumatology, country, and metropolitan, and it suits me. It's something, and it's not just fallen in my lap. I feel like it's something that I've had to really think carefully about what I want to do, and then really work towards it. And I think I'd urge you all to do that. Apart from these are my clinical commitments, and this is probably over 1.0 EFT. But on top of that, I do some teaching with the university, and I do some research on the side. So I supervise BMed Sci students. I don't have any this year. No one's put their hand up for doing a BMed Sci. Very few anyway, paediatric BMed Scis this year for some reason. Last year I supervised 2 BMed Sci students who some of you will know who they are, I'm sure. And I find that a thoroughly rewarding experience, and mostly because it's fantastic working with you guys, because you're bright, you're enthusiastic, and you have time, and I don't have time, and my enthusiasm wanes at times. So that's a terrific, and so I love that aspect of my work. I don't get paid for any of it. It's time that I have to find, but it's a terrific thing to do, and so paediatrics can provide lots of opportunity for research. And especially, I mean, both centres, RCH and Monash, but Monash really is developing a thriving research aspect, and I think going forward it's going to be a great place for academic paediatrics. So I think I was just going to leave it at that and field any questions, but perhaps we can answer questions as a group. But
Yeah, if you want to, or if anyone has any specific questions.
Do you see yourself going more into private practice as you progress in your career, or going more into public practice?
This is enough private practice. Private practice has some downsides and some things I don't like about it. I think I'll probably maintain this balance for a while and see how things go. I think it depends on other circumstances. The private practice is, in terms of time, it's actually more lucrative financially than a public session. And I don't have any problem saying that, but I think you could probably earn more money if you were purely in private practice. But it doesn't have access to the major public hospitals and the collegiality that you get there, the research opportunities, the teaching, that sort of thing, which is what I love. And the complexity of the patients really in the public sector is more interesting. In private practice, it's a different cohort of patients, there's no doubt. Yeah. There's different demands and different expectations that patients have as well.
How did you get into working with outreach?
Well, I mostly work out in Gippsland, which is where I spent that year. So I grew to love the area and grew to and came to know the paediatricians there really well. And they basically made me go back there. So a colleague of mine, Roger Allen, who's been a paediatric rheumatologist for many years, he's done outreach clinics around Victoria. And when I got back from Toronto, he was trying to cut back his outreach clinic. So he basically just handballed one to me. Yeah, it worked well and it suits me, and I do a full day there. I only go there once every 2 months. I could go more often. But again, it's a great mix of patients that I see out there. It's great.
With those outreach clinics, how do you find when you're just going there once every 2 months? Like, how do you keep up with it? How do you find that it's like sustainable kind of thing?
Financially sustainable, do you mean? Or what do you mean sustainable?
Like keeping up with the patients.
So the patients, there's an understanding that if patients have a flare of their disease, which is common in paediatric rheumatology, that they'll contact me either through the hospital or through my rooms. So and then between visits, I see them in the hospital or I see them in my rooms in Melbourne. Yeah. So that's actually not a big issue. That's doable. Yeah. Yeah. So.
Just a question a bit more about paediatrics in general.
Yeah.
What's kind of ratio of work for general paediatrics as compared to the specialties? Like, are there a lot more trainees that become general paediatricians than?
I suppose that balance is changing a little bit. There's a lot more people. I think a lot more people are doing specialty training these days. Although in a way, community paediatrics and behavioural and developmental paediatrics, which many people consider general paediatrics, that's a specialty in its own right. So I think there's probably more people going to specialty paediatrics. In the hospital setting, it's valuable, I think, to have another feather in your cap, and if you can bring to a department training in general paediatrics and a subspecialty, I think it adds something for the hospital. So in my situation, I think it makes you more employable, because all of a sudden you don't have to have a big appointment in one area, and you can be sort of divide your time across. But I think more and more people are probably heading towards specialties. Yeah,
is that mainly in the public world, or is there?
Probably a mix of both. So, I mean, there are some specialties that lend themselves to private practice, like paediatric neurology, for example. There would be a thriving paediatric neurology private practice out there, I'm sure. But specialties like paediatric hematology, or hem-onc is really all done in the public hospitals. I mean, you can't, you don't see many paediatric hematologists with their shingle up on the corner of the road. That's really it. So it depends on the specialty, I think. But most specialties do lend themselves to a bit of mix of both. If you I think as we move forward, and by the time you guys are looking for consultant positions, if you're looking for a position in a specialty, you really do need to have either had some training overseas or a higher degree. I think it's coming to that where that's probably going to be where things are to come back and work in an academic tertiary centre. I don't know whether that's Maurizio, whether you would think that with. I think so. Yeah.
It's very competitive,
It's very competitive, yeah.
Doing research, you can't just improvise. I mean, it's a good, strong background. Well, I recommend, all of you guys to think about doing a higher degree, because I mean that's been my route. But I've seen, a lot of people that actually benefit from, from doing a high degree. Yeah, it opens a lot of doors. I mean, it's one of the reasons why I came to Monash and I was appointed here is because I had strong background in research and I've done a high degree. It was much easier for me. So
it definitely opens doors and probably makes you a better clinician as well, I think, actually. So I think it's good in that sense. Yeah.
When you say higher degree, the obvious one that comes to mind is a PhD.
A PhD or a master's.
Is there anything else that you can do? Like,
it's really a master's or a PhD.
Yeah. I think University College London does the MD research, which is like a PhD, but it's 2 years. So I'm not sure what is available at Monash, but I think there should be something similar.
What's that one called?
It's an MD research.
MD research.
Yeah.
But you can do masters in all sorts of things. Masters in public health, masters in hospital management. I mean, you can do masters in lots of things, and you can do them while you're working. PhD is hard to do while you're working. You've really got to be. PhD requires it's a full on to do a PhD.
But you just need to think, if you really got to go really strong on academic, probably think about a PhD. But if you want to do research and clinical thing, probably something in master's would be already.
Yeah. The other thing I could probably comment on is the recruitment. It was a long time ago that I did my JMO year, but I used to be one of the interviewers for the SRMO jobs, which is the year after the JRMO. And I think what's been said is exactly right. If you can show that you've even from early on a commitment to paediatrics or an interest in paediatrics, in the sense of sort of volunteer work, or I mean, it's really amazing. I don't think I would not get a JRMO job now on my CV back then. There's no way. It's so competitive. You guys, it's ridiculous what you do, but you clearly just have to. And there's no doubt that when I was interviewing, all of the candidates are so good. Like it's tough. I don't envy you because you're all good, and it's just that having those things like the volunteering but research definitely, especially when you're looking at interviewing at places like RCH or Monash, where there really is a push for that. And I've had students who have emailed me and said, look, what about, can I just come and help with a project? And I've had summer students do projects for a few weeks here and there and just help out with data collection and all of that sort of thing, the small things. It doesn't necessarily come to a manuscript or a publication, but those sorts of things all add up and help, I think.
Probably is a question I'm going to regret asking, but how many...
I'm not on the panels anymore.
You said that there's 52 spots. How many people apply?
Last time, I think they said about 300. Was the number from last year, from when I went to I believe. And they interview, I think, about 100. I think that changed it this year, of course, but based on last year.
Yeah, my question is on the same sort of lines, but like, how many times should you apply before you give up?
Never give up.
Okay. But like really quickly.
I think there's lots of routes.
Avenues,
There's lots of avenues. So at Monash Health, for example, there are HMO 2 years where you can do part adult rotations and you do paediatrics. So we have some JRMOs on the paediatric wards that are doing adult medicine for the rest of the year, but they come for one rotation. And I mean that looks great if you're then applying the year after. And so there's ways to do it.
Yeah, I definitely have come across people who've been applying as some people don't know they're interested until quite late. They might have done general practice for several years and then changed their minds. Like, could be all over, but yeah, definitely lots of. I mean, took me 2 rounds to get in. I told you about some of the things I did, but people who worked it, you can get jobs in EDs. So there's a paediatric ED at Monash and also Sunshine and even the Austin. Lots of rural jobs will give you a rotation. Monash, Western Health, Northern Health, Peninsula Health. Like there's lots of ways to get a paediatric rotation, and people that I knew who similar to me were sort of applying as their second or third attempt. They were often the ones who were looking at interstate, and pretty much all of them I think ended up somewhere getting into paediatrics. But it's deciding if that's what you want to do and how passionate you are to keep trying for it.
And the other thing, of course, to remember is that if you don't get a position, that doesn't mean you're not going to make a great paediatrician, because so many paediatricians, don't get there the first time, and the interviews are not foolproof. I mean, the interview is not about, just.
Is there a maximum number of times you can apply? Like,
Sure, I don't think so.
I don't think we've tapped it yet.
There is free.
I'm not sure it actually applies also for not pediatrics in general, but pediatric surgery at least is a specialty which is expanding a lot. I mean, you can tell, see in Australia, I mean, there's brand new hospitals in Brisbane, I think also in Perth, the Monash Children's Hospital that didn't even exist as children's hospital as such. But I don't know if it's the same for pediatrics, but I think there's going to be a lot of jobs in the future. I mean, in terms of
I think so. I think pediatrics
population growth and
especially in the pediatrics subspecialties. I think for sure. I mean, I think we're probably behind adult medicine in the sense that it's moved away from a general physicians.
Absolutely, that's the same for surgery. A lot of general surgeon now they do one thing almost really, but it's happening the same I think in pediatrics. So
hopefully it doesn't mean that the death of the general paediatrician. I don't think that will quite happen because general paediatricians. Well, anyway, we'll see. But I think that's right.
But most of